My middle one's a freshman, I can't believe.
Wow.
Missed
Too
Tessner when
fast.
he was itty bitty.
Yeah, my son's about to graduate.
Oh. Now, what are his plans? What is he going to be?
He's going to go to A&M.
Oh, good. Yeah, I think my nephew. Yeah, well, come see us. Yeah, come see us. See, that's good. Perfect. Oh, no problem.
Y'all smile big so the tooth fairy can see your teeth.
Librarian dress up like a
Trying to work my way up to tray 7 for a year.
Oh, wow.
I may just give up and just bracket
Watch
the
your
top
fingers,
ones.
hands
Yeah, yeah. Well, just let us know. We'll help you whatever you need.
Y'all do Invisalign also?
We do some, yeah. So, but yeah, Bessie.
Pretty, and then they didn't bracket it far enough. And I first constantly pressing.
Yeah.
Orthodontic surgery, jaw broke, screws, all that. And they didn't do it on the top.
Oh, wow.
So I just kept pressing and they didn't bracket it far enough when I pressed, so I did another round.
Oh, wow.
It's still there, but I still can't get into tray 7. I think on tray 6. So I can't get into tray 7, so I'm going to just bracket from the top.
Yeah, well, just come on in and we'll
Jonathan, will you and Kayla switch, please? Kayla, will you switch with Jonathan, love? Thank you. There we go. Thank you so much, Jonathan. I appreciate that.
I know. They were excited about the snow. I think we may get some more at noon, they said. So. Oh, I know.
We're looking for Chris Fox. This is a good chance to see who's going to go to Blue today, who's above and beyond, showing respect, good Minshew manners, hands in lap, listening with eyes, ears, and heart. Excellent.
Okay. Everybody ready? All right. Well, good morning, everybody. Good morning. My name is Dr. Jennifer Buchanan, and I'm here today as a special helper to the Tooth Fairy. She called me up and said, I need your help, Dr. Buchanan. The kids in McKinney aren't brushing their teeth as much as they should, so please come and talk to them. So that's what I'm here today, to talk to you about dental health and how to take good care of your teeth. So, and I'm an orthodontist, and we'll talk about that more in just a little bit, too. But here I am, when I'm not in my costume. That's what I look like. And so let's start off with the first thing. With baby teeth, everyone say 20 baby teeth. 20 baby teeth. So you're going to lose 20 baby teeth. So that's why the Tooth Fairy wants them to be super duper clean, because you're going to lose them 20 times. And usually by age 2 is when most people have all of their baby teeth. Okay, so by age 2. So everyone say 20 baby teeth. 20 baby teeth. All right, so then probably about your age, when you're about 5 or 6 years old, the permanent teeth start coming in. Everyone say 32 permanent teeth. 32 permanent teeth. Yes, so that's a lot of teeth to come in, alrighty? So you've got to take good care of them. But age 5 and 6 is when you first start losing teeth. Don't worry if you don't lose any for a while. Some people are a little bit slower losing them, but that's okay. They always check that when you go to the dentist. Okay, be sure and save your questions to the very, very end, because we've got lots of cool things to show you, all right? Okay, so look at this. Wow, isn't that wild? So this is some of the technology we have in our office. This is a 3D image. So when you come to the office, it's real easy. It just takes 5 seconds, and we take an image of your skull, and we can change the colors of it and everything. But what's so great about it is that we can see how your teeth are developing. See, I'm sorry, my little pointer's not working as well, but the teeth at the very top, those are some of the permanent teeth that are trying to come in. And what happens is the permanent teeth start coming in, they start pushing the baby ones out and dissolving the roots. So we can count and be sure you have all your baby teeth in there. So that's what we do. So don't worry when they take the special pictures of your teeth, okay? All right, so teeth are very important. We need them for talking, right? It's kind of hard to talk without teeth. We need them to eat. Can't chew your food without your teeth, and then also to smile. So they're very important, so let's take good care of them. So eating, talking, and smiling. So very important. Okay, so let's talk about the anatomy of your mouth. Okay, everyone knows that you've got your tongue, and we'll talk about brushing that soon. And if you look in the middle of your mouth, there's a little thing hanging down that's called the uvula, and on either side are your tonsils. And what's kind of cool on your tongue, there's different parts of your tongue that taste different things. Your taste buds, like the sweet is more on the tip of the tongue, the salty is kind of in the middle, and the bitter and sour is more toward the back. So you have more of those kind of taste buds. So be sure you really brush your tongue so you can really taste your food too. Okay, so let's talk about how important our teeth are. We talked about eating and digestion. Okay, if you don't have your teeth, you can't chew your food. If you ever have seen anybody with dentures, they have a lot harder time chewing their food, which means fake teeth. They don't have their real teeth. So the first teeth you see in the front of your mouth, those are called the incisors, and they'll kind of like tear your food. And the pointy teeth at the corners, those are called the canine teeth, and they kind of call it canines because it kind of looks like a dog. And those also help you kind of hold the food. And then as you get farther back, there's called the premolars. They start crushing the food. And then very back, the big teeth in the back are called the molars, and they grind up the food. So the more you grind up your food, it's easier for your body to absorb all the nutrients and nutrition from all the food that you eat. So teeth are very, very important. Okay, let's talk about how to keep our teeth healthy. Okay, everybody say, well, we need to brush our teeth. Everyone say 2 times a day.
2 times a day.
Everyone say 2 minutes.
2 minutes.
A lot of people forget to brush for 2 minutes. I see my patients will brush their teeth, but they brush for like 30 seconds. So the most important thing is to brush for the full 2 minutes. So there's a couple different things you can do in order to brush for 2 minutes. You can turn on your favorite song and brush till the song's over. That's kind of fun. It makes the time pass by and you can kind of dance around. Or I'm going to teach you another song to show you how to brush as well. And we also want to use fluoride toothpaste. Fluoride in the toothpaste puts a coating around your teeth to protect them from cavities. Okay, everyone say hello to Smiles.
Hello, Smiles.
Yes, his name is Smiles the orchodontist. So orca means whale, so that he got that name. And because if you look really closely, he has braces. Yeah, see what was happening is poor Smiles couldn't chew his food.
He's a whale.
He's a whale, I know. He couldn't chew his food, and he couldn't talk very easily, and he couldn't smile. So now with his braces and nice straight teeth, he can smile and talk and chew his food. But he's going to show us how to brush our teeth. So I want everyone to point to your top teeth for me. Point to your top teeth. And repeat after me. Up like the sun.
Up like the sun.
Sun. Let's point down the lower teeth. Down like the rain.
Down like the rain.
Side to side like a choo-choo train.
Side to side like a choo-choo train.
All right, so we've got the outside. Now let's point to the top teeth again and open big and just point up there and pretend you're brushing. Up like the sun.
Up like the sun.
And point down your lower teeth. Down like the rain.
Down like the rain.
Side to side like a choo-choo train.
Side to side like a choo-choo train.
So we've got the outside, we've got the inside. And now when you're holding your toothbrush, you want to angle it, point it up toward the gums or down toward the gums. Wherever your gums are, point the toothbrush toward it. Because what happens is when you just hold it straight like this, you miss all the cavity creeps that are right there by the gums. That's the most place I see that my patients miss brushing is right by the gum line. So if you angle your toothbrush like this, angle it down, you can get all those cavity creeps. Okay, we've got the outside, we've got the inside. Now let's do the chewing part. So point to the top teeth again and repeat after me, please. Up like the sun.
Up like the sun.
And point down your lower teeth. Down like the rain.
Down like the rain.
Side to side like a choo-choo train.
Side to side like a choo-choo train.
All right, so we've got the outside, inside chewing parts. Now let's brush the backs of our incisor front teeth. So we're going to take this and take the toothbrush like this and just kind of work that like that. And then, let's not forget our tongue. Okay, everybody pretend like you're brushing your tongue, okay? Ah. Yeah, so it's important to brush your tongue because, well, a couple reasons. Because, well, one thing is you don't want to have dragon breath for your friends, do you? So it makes you have fresh breath when you brush your tongue. Plus, you can taste your food better, like I showed you with all the taste buds. You want to be able to taste your food. And also, if you say you brush your teeth really well, but you still have all that plaque and world. So if I ever need to cut into the enamel, we'll use a special tool sometimes with diamonds on it because diamonds are one of the hardest substances in the whole world. So, but what happens is if you leave the sugar on your teeth and it just sits there, what happens is it starts eating through that layer and makes holes in your teeth. And that's basically what a cavity is a hole in your tooth. So, and when you start getting a hole in your tooth, it eats down to the second layer, which is called the dentin. And that's what gives your teeth the color, is the middle part called the dentin. But the very middle, as you can see up here, is called, and that also causes you to have the discomfort. And then down on the bottom, underneath your gums, are the roots of the teeth. So you don't see those unless when you lose your baby teeth, you see those coming out. So, okay, well, let's talk about some other things to keep our teeth healthy. We need to have a really healthy diet. So be sure you're getting enough from the milk, meat, fruits and vegetables, bread and cereals group. Now, I know Valentine's Day is next week, so you're probably going to have some parties at school. And now, if you're going to eat candy, the best candy for your teeth is chocolate. Okay, so if someone says, hey, have some taffy or chocolate, eat the chocolate, okay, because chocolate has a special chemical in it that kills bacteria in your mouth. Okay, so the darker the chocolate, the more of that chemical's in there. So, and if you can kind of do a little taste test yourself sometimes, like eat a hard piece of candy, and you can kind of feel that you still have that sugar and it sticks in your teeth. Sometimes you get little pieces, especially in your back molar teeth. Something to eat. Chocolate is the better candy that you pick, okay? Yeah, and really the worst thing for your teeth are sodas, okay? Sodas, even if they're diet sodas, are really, really bad for your teeth because what happens is there's sugar in it for one thing, and the second thing, it has the acid in there. So you can even do another experiment with like eggshells and put different eggshells with sodas and see how it starts staining the eggshells and causing problems. But again, that'll just work and eat holes in your teeth really, really fast. A lot of people say, oh, you know, I just had a soda. I haven't eaten anything. I don't need to brush my teeth. But actually, if you have a soda, that you need to even brush even more. So try to really drink your water. You know, I mean, milk's better and juice. I mean, some of the juices have a lot of sugar, so kind of watch those too. But, you know, try to brush. Even if you just drink something, it's important to brush because that sticks to your teeth. And on that exercise wheel. But then the rat that ate all the junk food, his teeth were brown, his fur was kind of scraggly, and then he was just kind of laying there. He had no energy. So you really are what you eat, so be sure you have a healthy diet so you can feel good to play with your friends and listen to your teachers at school, plus just your teeth to be healthy too. Okay, so when we're brushing, we're going to fight away plaque. Plaque is that white film that forms on your teeth. Like if you scrape your teeth sometimes, if you haven't brushed in a while, you'll see that white stuff. So plaque, that's what forms. And basically what happens is that we all have bacteria in our mouth, but if you leave the sugar in there, it eats it, and then it makes the plaque. It's kind of like bacteria potty in your mouth. So that's why you got to keep getting it out of there. So I know it's yucky sounding, but it'll help you remember. So, and we also want to prevent gingivitis, so that's gum disease, and I'll show you a picture of that in just a minute. Okay, so we already kind of talked about the plaque. It's like a clear film. It's hard to see. Sometimes you can get those little tablets at the dentist where you chew them up so you can see where you're missing. But yeah, those are cavity creeps, man. They'll if you don't get it off there, they're just working, especially at night. They love to work it overnight. So brush your teeth. Most important time to brush is right before you go to bed because it has all that time to work at night. You know, they come and they're like ants at a picnic. You know, they're like, ooh, food, yay. So you want to get that off so they don't have a picnic in your mouth. Okay, so if your gum disease makes your gums real swollen and puffy, see, not yucky? Ooh, you don't want that to happen to you. So what happens, some adults, the way they lose their teeth is a lot of times through gum disease. What happens, they're not flossing and brushing right, so what happens on the bacteria gets underneath their gums and it starts eating away the bone that holds the teeth in, and the teeth just fall out. And so that's how they lose their permanent teeth that you shouldn't lose at all, okay? So definitely need to floss. We want to brush our teeth and floss our teeth because you don't want to be the funky monkey. Look at him. He's funky monkey. You don't want to be the funky monkey. No, don't want to have the yucky teeth like him. All right, so we're going to brush how many times a day? For how many minutes? All right, good job, guys. You were listening. Okay, and we're going to also need to floss because even if you're brushing well, like I said, the bacteria can get underneath your gums. So next time you go to the dentist, they can show you how to floss properly, and your parents can also help you too. But just be sure to really floss and get in a good habit. You're a good age right now to really start that important habit because we're finding that it really makes a big difference in your overall health. It's not just about your mouth being healthy, but it affects your heart, it affects your brain, it affects all these diseases. We're finding now that there's a link with gum disease and pneumonia and diabetes and, like I said, dementia, Alzheimer's, where you lose your memory. So you don't want to have that. So floss your teeth so you don't get dementia. They're like, all right, sounds good. Okay, another thing we need to do is visit our dentist twice a year. So if you haven't had your teeth cleaned or seen the dentist in a while, you may want to ask your parents and say, hey, it's probably time to go. They have pediatric dentists that are nice.
15. Please post your attendance. Thank you.
Perfect. And so be sure to go to the dentist twice a year. And there's nothing to be afraid of. Usually they'll sit you in a chair and they'll count your teeth, and they may take the special pictures or the x-rays of the teeth to see how your teeth are developing. But if you don't understand something, just ask them, okay? There's no reason to ever be afraid. And then one thing you may ask them about too, which a lot of you are starting to get your 6-year molars. When you get those in, they probably want to put some what are called sealants on those. It's almost like a little plastic coating they can put in the grooves of your teeth, so it kind of keeps the bacteria and sugars from getting stuck in the little grooves. So ask your dentist about the sealants when you go there too. And sometimes when you're at the dentist, they may recommend you come see me, the orthodontist. Usually around age 7 or 2nd grade is a good age to be evaluated to see if you need braces. Because sometimes if your jaws aren't growing right or your teeth don't have room to come in, it's a good time to come in. So we can go. And we have some, an orthodontist, what I do as an orthodontist, I straighten the teeth. Because again, if your teeth aren't in a good position, you can't talk, you can't eat, and you don't want to smile. Too, there's even I need to get my picture back here, but I have a picture of a dog that had braces. What happened, this veterinarian had to put braces on this little dog because she couldn't chew her food because her teeth weren't in the right position. I don't put braces on dogs, but just to let you know that can be done, and that's even another career. But yes, so to straighten the teeth. Okay, here's some problems we see sometimes. If you have some crowding and it makes it real hard to brush your teeth, you can see how they're kind of having a hard time, and it's like in a crossbite, meaning that it's trapped behind. So that's something we'd want to see early. Another thing we look at is just if you maybe have too much space. Sometimes if you have too much space, it won't allow the other teeth to come in. So we look at that, and we'll want to correct problems with that. Also, if you have an overbite, if you have your upper jaw ahead of the lower jaw, that's another thing we would like to correct. Or if you have an underbite, the opposite way, kind of like the bulldog bite, underbite, that's another thing, because that can give you problems with your jaws and make it harder to chew. So. Okay, so braces are just like tiny little brackets that go on your teeth. Touch your teeth. If you just touch your teeth, that's what it feels like to put braces on. So it's super easy. And then what I do, how I put the brace on, and then we thread a little wire in there, tells the teeth how to move. So we have these special wires that were developed by the NASA space program. They're really amazing. I'm going to show you. I'll show you on the screen, and then I'll show you since I can demonstrate so y'all can see. But does it have the picture of the wire? Oh, here it is. Okay. And so I'm going to show you this wire. The first wire we put in when you get your braces is made of this wire called copper, nickel, and titanium. It's really a flexible wire, but let me show you what's magic about it, is that when it's in cold water, this is a cup of cold water, and I put it in the cold water, I can bend it up in any shape. So it's very gentle to put the wire in, have your teeth in position. But then watch what happens when I put it in the hot water. Da-da-da. It goes back to shape. You can kind of see that on there. I'll do it again. But it's pretty amazing because we tell our patients, or our adults that drink a lot of coffee, it helps their teeth move a lot faster, but it's very gentle. See how it is? It looks like it's like a pretzel or something. And then da-da-da. And we put it in that cold. Pretty neat. So maybe someday you guys can discover some magic like that. Yeah, I know. Yeah, it's pretty cool, isn't it? It's just like you guys. It's a smart wire. The crystals, when it gets a certain temperature, they know to line up. It's just like you know to line up when your teachers tell you to line up. So that's how that works. Okay, so I use a technology called the Damon system, and it's really exciting because we have Bethany Hamilton, the Soul Surfer. I don't know if any of you have seen that movie, but she is the spokesperson. She had the Damon braces, and we got to meet her at one of our meetings. Just very inspiring because, she was a surfer, and a shark got her arm, and so she just, very brave and still a great surfer now. But if you want to go back, you can kind of look at her pictures, her before and after. So you can kind of see there before she kind of had that underbite. And then after the treatment, there she is. So it's just amazing. That's why I love being an orthodontist. We give our patients the smile, and that's something you have the rest of your life. So smiles forever. It's not me, but I like her, so that's good. Okay, well, let me show you just some cases with some braces. So a lot of times I see this where there's not enough room for the teeth, or teeth are trapped up there. Before I had the Damon Smile technology, we'd have to take out teeth or do these expanders, but we don't have to do that anymore. So here he is after braces, no teeth removed, no surgery, no expanders. And then the next slide is another one before and after. Here she is before, and then here she is after. So it's really amazing, the transformations. And what's great with this technology, we can do this with adults too. It's not just for kids anymore. I have patients in their 70s. And especially with this technology, it moves bone and teeth no matter how old you are. So that's what's amazing. Because a lot of adults, cases that would have had to have extractions or surgery aren't needing that anymore. So you can just see that, yeah, just amazing, the before and the after. And then our patients have confidence and they're excited to smile. And so just to tell you how to become an orthodontist, some of you might be interested. I wanted to be an orthodontist probably since I was about your age. And so basically, I went to UT Austin, and my degree is in secondary education, so that means I could teach middle school or high school science, but I love teeth, so then I went to dental school at Baylor College of Dentistry, and actually last weekend we just celebrated 20 years since I graduated dental school. I can't believe that. And then it takes 2 to 3 years to specialize to become an orthodontist. You become a dentist first and then you specialize. So, and then I've been in McKinney here since 1996, so almost 18 years here. So let's review some of the things that we learned, okay? All right, so go ahead, you can. And then you learned how to become an orthodontist. And then another thing, we always like to tell our patients we always want to give back. That's why I love doing this. I get to help you guys be healthy because this is something you can keep the rest of your life and always remember because it's going to make you feel good the rest of your life to keep good care of your teeth. So, okay, a couple other things to show you. And if you look real carefully, these are some of the little Beanie Babies. And if you look real closely, they have braces on them. And what we do at our office, if you want to bring in your special stuffed animal, we'll put braces on. Yeah, they're really little because these are little animals. But we'll put braces on them for free. And the reason we'll do that is that every time you see your special animal, you'll go, wait, did I brush my teeth twice today? Am I eating healthy foods? Am I going to the dentist like I'm supposed to? Or should I go see the orthodontist? So just remind you to take good care of your teeth. So you can bring that into our office. You're going to get a little backpack to take home today. It has our phone number, a little free mail from Texas Roadhouse. So you get all kinds of good stuff today. So pretty cool things. Yay. Good stuff. Y'all did a good job listening, all right? And okay, let's see. Very good. So you get a spin brush. There you go. Good job, man. You're welcome. Okay. Okay, raise your hand if you know what is something healthy to eat. Let's see. Fruit. Very good. All right. Oh, yeah, I know. That's good. Okay. Let's see. How many times should you go to the dentist? Okay, they're in the striped shirt. Yes, you. Yes. How many times a year?
Please, for all of us? No.
Very good. Okay, here, y'all may have y'all go take that back to her, please.
Which one?
And the stripes right there. Okay, let's see. Okay, how many minutes should you brush your teeth? In the back right there. Yes, you, the striped boy. How many minutes should you brush your teeth? Very good. All right. Okay. All right, let's see. That's another good question. I'm thinking. Okay, let's see. Okay, and then try to think of another good one. Oh yeah, that's a good one. What's the best kind of candy for your teeth? Okay, they're in the middle. Chocolate. All right, girls rock. All right. Okay. Have anybody lost 4 teeth? Oh, wow. Some of y'all are fast. Anybody lose 5 teeth? A few of y'all. Have y'all lost 5 teeth? Wow. That's awesome. Anybody 6 teeth? Anybody 7? You lost a lot of teeth. Oh, you're 7. I know. I was funny. My daughter would be like, I'm 7 and I've lost 7 teeth. I'm like, oh, that's good. All right, guys. Well, give yourself a hand. Y'all did such a good job. I don't know if they want to learn the dance that goes with the brushing song. Okay, everybody stand up. We're going to learn the dance that goes with the song. Okay. Okay, well, you'll learn it really quick. Oh, I like that. That's so cute. Okay, everybody ready to learn it? Okay, here we go. 1, 2, 3. Okay, everybody go. Up like the sun, down like the rain, down like the rain, side to side like a choo-choo train. Okay, now we can do it together. Up. Okay, go. Up like the sun, down like the rain, down like the rain, side to side like a choo-choo train. Okay, y'all don't have to repeat. We can just do it together. Let's do it all together. All together. Okay, everybody. 1, 2, side like a choo-choo train. Up like the sun, down like the rain, side to side like a choo-choo train. So when you're brushing and getting, you can just sing that song, and it'll help you brush for 2 minutes. All right, guys, well, we're so proud of you, and we're glad you're going to be so healthy. So have a wonderful day. All right. Thank you.
Nice line. Show me sharp. Out.
Thank you so much. I'm so excited to be here. Again, my name is Dr. Jennifer Buchanan, and I'm here today to talk to you about dental health. I've been an orthodontist here in McKinney since 1996, so we're going on 18 years in McKinney. It's hard to believe. We have a big sports theme office, lots of sports autographs, so it's a lot of fun. But before we can go ahead and get started. So, again, I already told you about me, so we can go ahead and go on. So first of all, let's just talk about baby teeth. You're going to get 20 baby teeth. Everyone say 20 baby teeth. 20 baby teeth. Or I guess in your case, lose 20 baby teeth, right? So most of you probably lost a lot of your teeth by now. And usually by age 2 is when you get all your baby teeth in. I mean, but it's variable. I mean, I know some people that don't even get their first tooth till they're almost 2 sometimes. So some people can be a little delayed, but it's just dental age is not the same as your chronological age that you are. So, but let's talk about permanent teeth. So eventually you're going to get 32 permanent teeth. Everyone say 32. 32. So eventually you'll get 32 permanent teeth, and that includes like your wisdom teeth as well. So you get your 6-year molars when you're 6, your 12-year molars usually when you're 12, and then your wisdom teeth usually start developing coming in when you're about 18. Okay, well this is a great picture here. This is a 3D image. In my office, we use what's called the iCat, and it's really amazing because it only takes 5 seconds. You don't have to have all these crazy things in your mouth like we used to do with the old types of x-rays, but we can get this kind of image, and what's really amazing is that we can see how the teeth are developing. So if you look at the top over here by the nose, right underneath there, those are some permanent teeth. And what happens as your permanent teeth develop, what they do is they start pushing the baby teeth out. They dissolve the roots of the baby teeth and push those out of the way. So this is really a great way for us just to look at all our patients when they come in, be sure everything's developing correctly, seeing if you're having a problem. Sometimes you might have an impacted tooth that's trapped up there. Or sometimes we've also seen, we had a Marine that had been wounded in combat and had a bullet that was still in his skull, so we could see that. Or even people with BB guns are like, oh yeah, I never told my mom we had the BB gun fight, and I still have the BB right there. So we've been able to see some very unusual and interesting things, or sometimes extra teeth, different things like that. So, but let's talk about why our teeth are important. Of course, we need our teeth to eat. I mean, it'd be pretty difficult to chew your food if you don't have teeth, right? If you know of anyone that has dentures, they have a little bit of trouble chewing their food. So be thankful you have your real teeth, and you need to take care of them, because again, it's nothing as good as what you originally were given. So also for talking, a lot of people don't realize that you need your teeth to talk and to make sounds. And then another thing, of course, to smile. I mean, a lot of times if you don't like your teeth, you won't smile, and that's not a good thing. We want you to smile and feel good about yourself. So teeth are so important. We've got to do some things to take care of them. So let's talk about that. But before we get to that, let's talk a little bit more about the anatomy of your mouth. So everyone knows where the tongue is. If you look in the middle of your mouth, the little thing that hangs down, that's called the uvula. People always wonder what that is. Sometimes I've seen it where some people have like 2 there. But also you have tonsils. And so sometimes I'm seeing for some of my patients that if their tonsils are really big and they can't breathe, that it also affects the way their teeth are coming in. So sometimes when we take those x-rays, we could see if you might need to go see the ENT to have your tonsils and adenoids looked at. Because we don't want you getting sleep apnea when you get older, because that means where you quit breathing when you're sleeping. We don't want that. So that's one of the things that we look at as well. And of course on your tongue, you have all these taste buds. And the sweet taste buds that determine more of the sweet taste is all on the tip of your tongue. Middle is more of the salty, and then toward the back is more the bitter and sour. So again, you need to really keep your tongues clean so you can really taste your food too. So we'll talk about that more. But another thing that teeth are important for is just in the whole process of digestion. The front teeth that you see, those are called the incisors, and those usually like kind of tear food. The corner teeth are called the canines, and those kind of like hold food. And then as you go further back in your mouth, those are called the premolars, and those start kind of grinding the food up. And then really when you get back to the molars, it really does the final kind of grinding, because if you can't grind up the food, then your body can't process all the nutrients. So again, our teeth play a very important role in digestion. Okay, let's talk about how we can keep our teeth healthy. Okay, we need to brush our teeth for at least 2 times a day. For 2 minutes. Everyone say 2 times a day. 2 times a day. And everyone say 2 minutes. 2 minutes. That's the thing I find with most of my patients is they brush their teeth, but not for 2 minutes. So the best thing to do is maybe turn on your favorite song, brush till the song's over, and that'll help you because most songs are roughly about 2 minutes, so you can get your full brushing in. But again, they have the timers that you can buy now too, but sometimes if you're just watching the clock, 2 minutes goes by really slow. So trying to find some fun ways that we can do that. And then also be sure you're using a fluoride toothpaste. I don't really think they make many non-fluoride toothpastes, but fluoride actually helps coat your teeth and kind of make them stronger so you don't get cavities. Another thing too, another important fact you might want to know is that in your saliva also has some protectants for your teeth to keep you from getting cavities. If you ever know anyone that has to have radiation therapy for cancer, their mouth gets really, really dry, so they're really at risk of getting lots of cavities. So again, your saliva plays an important role to protect your teeth as well. Okay, I know y'all are 4th and 5th grade, so this is a little bit, above your this is more for the younger kids, but we'll tell you anyway because it's kind of a fun way to remember about how to brush. So basically, everyone point to your top teeth, and I want everyone to repeat after me. Up like the sun, like this sun. Point down to your lower teeth, down like the rain, side to side like a choo-choo train. Choo-choo train. So we kind of get the outside, and then you also want to do the same thing and get the inside of your teeth. So we'll do it again. Up like the sun, down like the rain, side to side like a choo-choo train. So we've got the outside, we've got the inside. Now don't forget the chewing parts of your teeth. So let's do it again. Up like the sun. And go down the lower, down like the rain. Side to side like a choo-choo train. Okay, I'm going to put the mic down for just a second because I do have a loud voice, but so I could show you, kind of demonstrate a little bit more on some brushing techniques with the big toothbrush. So hold on a second. All right. Okay, so this is Smiles. Everyone say hi to Smiles. Hi, Smiles. Actually, his name is Smiles the orthodontist. And so he got his name, one of my patients named him, and I thought that was very clever because, of course, orca means well. But if you look really closely, you can see that he's got braces. He was having trouble chewing his food, and he was also having trouble speaking and saying his words clearly, and then, of course, he didn't want to smile, so that's why he has the braces. But as far as brushing technique, I think this is what most of my patients really forget about. Like, they'll go like this, and you just go straight across, but what happens is you miss all of the gum, the bacteria and plaque that's at the gum line. So what you really need to do is angle the toothbrush up. So point your toothbrush up toward your teeth. Oh, thank you. She's getting me all.
There, you won't have to. Yeah.
There you go. Getting me all mic'd up. But like I said, I'm pretty loud anyway. So you want to take the bristles of your brush and point it up toward the gums when you're brushing the upper, and then point it down when you're brushing the lower teeth. And same thing when you're brushing on the inside. Try to point it toward the gums because that way it can get all of that underneath there. And you can kind of go in circles too if you like, but just being sure the biggest key is to really be sure you're getting at that gum line. There's a lot of things now that you can also use in addition just to a regular toothbrush. We recommend a water pick, especially with braces. You can put hot water in that, and that helps some of our technology work faster. I'll show you that in a minute, but also kind of helps get in between the teeth. And then also a lot of the electric toothbrushes are very good as well. So just being sure that you're doing that and really at least 2 times a day. I know sometimes at school you don't get to brush your teeth, but definitely morning and night is very important. So, all right, so you'll know the proper technique. Oh, and don't forget to brush your tongue, okay? A lot of people, they oh, I brush my teeth, I don't need to brush my tongue, but the thing is, if you get all the bacteria and germs off your teeth, but they're still on your tongue, it's going to kind of get back on your teeth pretty quick. Plus, also for fresh breath and then to be able to taste your food better, it's good to brush your tongue. So, all right, well, very good. Moving on to the next thing. Okay, let's talk about just the anatomy of a tooth. The part that you see in your mouth, the pretty white part, is called the crown of the tooth. And that's made up of what we call enamel. Enamel is one of the hardest substances in the whole world. So if we ever need to cut into the enamel, we use special tools that have diamonds on them. Because diamonds are one of the hardest substances in the whole world. But if you leave sugar and food on your teeth, what happens is the bacteria starts making acid, and basically the acid just starts eating holes in your teeth. So it starts going through the layers. So the next layer is the dentin, and the dentin is what gives your teeth their color. A lot of people freak out because your baby teeth have a lot more enamel than they do dentin. So your baby teeth are going to be whiter in color. So when you get your permanent teeth, they'll look a little more yellow, but don't freak out. A lot of my patients are like, why are my permanent teeth so yellow? I brush them all the time, but it's just because that layer, there's more of that dentin layer. And then sometimes they didn't know this many years ago, but certain medicines, if you took certain medicines, it would change the color of your teeth. Like if you took tetracycline, you'd almost get this gray color to your teeth. So luckily they don't give that anymore because that does affect how those teeth, the color. Really what I want to figure out is if maybe there's something I can give them and then they'll be white all the time. So or y'all figure that out. Somebody needs to figure that out because there's got to be a way. But anyway, so as you travel to the next layer, it's called the pulp, where basically that's the nerve of your tooth. So if you do get a cavity, that's why you feel it, because it starts eating a hole, and so there's no insulation anymore. You've gone through those layers. And again, just that acid can just eat all the way through those. Down the bottom is called the root of the teeth, and you've got different layers of what's called the cementum, which is on the outside, and the periodontal membrane. And actually the periodontal membrane is what helps us move teeth with orthodontics. So I'll talk about that in a little while. Okay, well let's talk about some other things to keep our teeth healthy. We need to have a healthy diet. Of course, you need to be sure you're getting enough in the milk and the meat, fruit and vegetables, bread and cereal group. And of course, I know Valentine's is coming up. So if you're going to have your Valentine parties, the best kind of candy to eat is chocolate. Okay, so the darker the chocolate, the better. And a lot of people, I mean, it doesn't mean you don't brush your teeth. Now, don't go home and go, oh, she told me just eat chocolate and that's it. No, you can eat chocolate but brush. But again, if you're picking between, say, taffy or hard candy, pick the chocolate because it's better for your teeth. It has antioxidants in it to help kill bacteria in your mouth. Plus, it doesn't stick to the teeth like a lot of those real sticky taffies and hard candies do. So like on your molars, if you look at your back teeth sometime, has all those grooves in it. And so if you leave some of that candy in there, it just sits there and it just really works and really makes those cavities very quickly. Okay, and then probably the worst thing for your teeth are sodas. That's the number one worst thing you could have, because not only do they have sugar, but the acid in them. Even if they're diet drinks, it has that acid, and that just eats away at those layers and allows those cavities to form so quickly. I remember when I was in dental school, the patients that would come see me were always the ones that were drinking sodas all day. They're like, oh, I brush my teeth after I eat, but they weren't brushing after they were drinking their soda. So it was happening, just that soda just bathing on their teeth all day long. And so they would just have, tons and tons and tons of cavities. So try to pick something healthier, definitely water, milk, juices. You still have to kind of watch out for some of the juices because they've got a lot of sugar in those too, but still watch that. But again, just feeling healthy. Before I really get into the next subject, talking more about healthy, this is an experiment that I did when I was in 4th grade, around y'all's age, so this would be a fun thing for you to do. We took 2 rats. We fed one rat Ding Dongs, Cheetos, and Coke. Then we had the other rat and we fed him dog food and carrots and water, and we watched to see what would happen over a few weeks. And what we found is that the one that ate all the healthy food, he had really shiny fur, his teeth were all white, he was like running on the exercise wheel all the time. The other one that ate all the junk food, his teeth were brown, his hair was all scraggly, and he just kind of lay in there. He had no energy. So I know you always hear that you are what you eat, but you truly are. And here I am many, many years later, and I still remember my 4th grade project with the rats because you could see what was happening. So, okay, well, let's talk about, we've got to fight away that plaque, and we want to fight away any of the extra bacteria in our mouth, and then we also want to fight away gingivitis, which is gum disease. So I'll show you a picture of that in just a few minutes. But basically, plaque, if you scratch your teeth and you get that white stuff, that's what plaque is. It's that clear kind of film that's hard to see. Sometimes if you're having trouble removing the plaque or knowing where it is, they have these little tablets or rinses that you can rinse out and will show you where you're missing. So maybe ask the dentist about that, or look, kind of look when you're at the grocery store or shopping. They usually have some of those rinses that you can look at. But you want to get all that off of your teeth because, again, it just makes that film. And the bacteria, we all have bacteria just naturally occurring in our bodies, but if you leave food on there, the bacteria is like, ooh, okay, party, let's have a little picnic in your mouth, and they're just having a party in your mouth, so you don't want that. I mean, I know this is kind of gross, but this is a good way for you to remember it. So basically, we all have bacteria living in our mouth, and if we leave some of our food and the sugars in our mouth, they eat it, and then they have to go to the bathroom, right? So all that plaque is the potty left over from all the bacteria. And I know that's gross, but it'll help you remember, like, oh, I don't want that potty in my mouth. So that's basically, and then what happens, and then it makes that acid, and then it eats through that layer, even the enamel that's so tough. So anyway, sometimes you just have to get it graphic so people can really realize that it's important. Okay, so this is gingivitis. So basically, gingivitis is gum disease, and it's where your gums get swollen and puffy and red. I mean, that's just nasty. You don't want that. And you can prevent that. That's the thing, just by brushing and flossing, you can prevent that. But if you don't prevent that, what happens is that the bacteria and all that acid gets underneath your gums and starts eating the bone away that holds your teeth in. So you lose your permanent teeth, which you're not meant to lose. But that's how a lot of people have dentures, is because if they didn't floss their teeth and take good care of them, they got that gum disease and just lost the teeth. So, but that's why we wanted to educate you now, because what you do now is going to affect you, for the rest of your life. Okay, so we want to brush our teeth. We don't want to be the funky monkey. Look at his smile. We don't want that. No. Yeah, don't want that. So definitely want to brush. Okay, and how many times are we going to brush a day? For how many minutes? All right, awesome. Okay, and we got to also floss our teeth. This is important. And definitely let your parents help you, or next time you go to the dentist, have them watch how you're flossing. One thing I noticed with some of my patients, they'll put the floss between the teeth, but they won't go all the way up underneath the gums. When you don't go underneath the gums, you're still missing all of that stuff that gets trapped underneath there. So being sure that you're flossing too, because brushing alone is not enough to keep away all the bacteria and germs. And there's a lot of new research out now that's amazing about why oral hygiene is important. For many years they've known that there's a link to heart health, like you can have heart problems from having a lot of bacteria in your mouth, because that gets in your bloodstream. But now what they're finding is that you can also get dementia, where don't remember stuff, Alzheimer's, diabetes, pneumonia. I mean, there's so many things that they're finding now. If you don't mind. Yeah, she's going to flip. There you go. Yeah, I forgot pancreatic cancer. I don't know. It's kind of just cutting some of those off the screen. But basically, the whole message is that it's so important to take care of your teeth. It's your whole body. I mean, it's not just your smile, but it's your whole body feeling good. So, yeah, rheumatoid arthritis. I know, I forgot about all those other ones. There's a lot of good ones. Okay, we need to visit our dentist. How many times a year? 5. Yeah, 2 is kind of the magic number. So if it's been a while since you've had your teeth cleaned, you may want to talk to your parents about that, because it's just like anything with your car. You change the oil, stuff like that, but you need to be sure that you're getting a good checkup, because they can find things before they become big problems. And if there's a small cavity, a lot of times they can put on what are called sealants. Probably many of you have those sealants. It's basically just like a plastic coating over your back teeth to kind of prevent all the bacteria and sugars from getting in the grooves of your teeth. So ask about sealants next time you go to the dentist as well. So a lot of times when you're at the dentist and they look about how your teeth are fitting together, or you're crowding, they'll say, hey, you probably need to go see an orthodontist. So basically, as an orthodontist, ortho means straight, dont means tooth, so I'm into straightening of teeth. That's what orthodontics is. So when we use braces to straighten the teeth, everyone touch your teeth. That's kind of what it feels like to put braces on. So it's really gentle, really easy, and so there's nothing to be afraid about. So we always tell you what we're doing. And usually we say you should probably visit us, the orthodontist, probably by age 7 is a good age to visit, or 2nd grade. But it's never too late. I mean, I've got patients, 70s and 80s too. Okay, so these are some of the common problems that we deal with in where you might need to come see me. I mean, you don't have to have your dentist say you need to come see me. If you just see these problems going in your mouth, you could come see us. So basically, lots of crowding. And when you're crowded like that, as you can see over here, they're having a hard time keeping things clean. And then again, you're more at risk of having gum problems and all these other diseases. So, or what we call a crossbite, where the teeth kind of fit behind each other instead of over in the front. And then spacing, that's another issue that we deal with. So if you have too much space, that can cause a problem too. And sometimes if anyone's a thumb sucker or tongue thruster, that kind of messes up how your bite is fitting together. Or an overbite, where you have the upper jaw ahead of the lower jaw. So that's another thing we need to correct. Or an underbite, if you're like this, kind of like the bulldog. So that's another bite we'll correct. Kind of talking about dogs, this is something you might be interested in. They actually have dentist veterinarians. I need to get my picture back in my slideshow, but I had a picture of a dog that has braces. Because what happened, she couldn't chew her food, and she was starting to lose weight. They're afraid she was going to die, so they put the braces on her teeth so she could chew her food. So even dogs can have braces. I don't put them on, but I can probably find you somebody that does if your dog does need it. But anyways, but that's one of the things we can deal with. So we kind of talked about braces. They're just like little brackets that go on your teeth. And what we do with braces, we put the little brackets on, and then we thread the wire through there, and it tells the teeth how to move. And so, like I said, one of the wires that we used was developed by NASA. And it's really cool. They use this wire on the satellites. So when the satellites would orbit around the sun, the panels would open with the heat. And when the satellites would orbit away from the sun, when it was cold, the panels would close. So basically, this is really cool. When you come to my office, I can show you this in person. It's just kind of hard with a big group to demonstrate. But basically, in cold water, I can bend that up in any shape, this wire that we put in. So however your teeth are crooked, it's very gentle to put the wire in. But then what happens is when it heats up and just being inside your mouth, or when you drink something hot, it goes back to the shape. So it's just kind of like you guys, you're smart. When your teachers tell you to line up, you know to line up. So when it gets a certain temperature, it knows to line up. So pretty cool. So we also ask our patients to use a water pick with hot water because that helps it move faster. So again, the technology we use has just come leaps and bounds, from when it was when I was your age. It's amazing the transformation. So, and then something that is really cool that we have now in our office, we're the first office in the DFW area to have, it's called the Lithos scanner. Basically what this is like a little wand, and we scan your mouth so you don't have to have all the gooey impressions made. And then a lot of the adults are using some other technology with it where we custom make braces for their teeth. It's pretty cool because I tell them, okay, this is how we want to move it, this is what we want to do, and we can just custom make the braces just for you to make it go even faster and easier. Okay, well, one of the other technologies we use is called the Damon Smile System, and the Damon spokesperson is someone you probably all know, Bethany Hamilton, the Soul Surfer, and we got to meet her. She was at one of our meetings. It was really great. She's very inspirational, and just her whole story. I mean, a lot of you probably know, but she just didn't give up. She's like, hey, I'm going to keep surfing, even though my shark took my arm. I'm going to keep going. But here she is before treatment, and then after treatment. So she just always talks about how it gave her that confidence to have a great smile. And again, that's what I love about being an orthodontist, that I give my patients something they can keep for the rest of your life. You may have different cars or different homes, but you only have one smile, and it's going to open lots of doors for you. I mean, it gives you that confidence to be all you can be and feel good about yourself. So I'm just going to show you now just some kind of before and after pictures. Here's a patient. This is very common what I see, very crowded with teeth kind of all up in the gums. And so luckily with our technology now, we can treat his case, no teeth removed, no expanders, no surgery. So it's been amazing with this technology what we can do. Because used to, when I was growing up, the only way we could treat it was taking out teeth or doing these expanders. So it's a lot better now. And there is after. And then we've got some more before and after. So that, to me, that's always the fun part, to really see the transformation. Here she is before. Oops, I'm going to go back just so you can see her. That was kind of fast. But yeah, just see how beautiful. I mean, she just has that gorgeous, gorgeous smile. And then go ahead and get the next one, before and after. And like I said, we have a lot of adults in treatment now too. I mean, 70s, 80s. I mean, it's never too late. So a lot of people think, oh, I've had my teeth that way my whole life. But it's nice, any age we can treat you. So here's just some more good before and after. So again, just having that confidence and feeling good. So many of you may wonder, well, how do you become an orthodontist? So basically it takes about 10 to 11 years of school. I went to UT Austin, and my degree was in secondary education, so that means I could teach middle school, high school science. But I love teeth, so I was like, I've got to become a dentist. So went to 4 years of dental school at Baylor College of Dentistry. And actually, we had our 20-year reunion last week. I can't believe that. I'm like, have I been out that long? But it goes by fast. And then and I also did my orthodontic specialty at Baylor College of Dentistry. So in dentistry, you learn how to do a little bit of everything, but then I wanted to specialize. There's other specialties besides orthodontics. There's periodontics, which is surgery of the gums, oral surgery. There's pediatric dentistry. There's endodontics, which are root canals. There's lots of different specialties. But again, and like I said, I've been at McKinney since 1996, so going on 18 years. Okay, let's review some of the things that we've learned. Okay, you've got to protect your teeth from the bacteria, gingivitis, and all the plaque. How many times we need to brush a day? And how many minutes? All right, you're listening. We've got to eat a healthy diet, okay? And go to the dentist how many times a year? And when do we need to go see me, the orthodontist? Age 7 is a good age, but not too late for you guys to come see me. If you feel like your teeth aren't coming in or you're having a hard time keeping them clean, you can come to our office, and there's no charge for the consultation for you to come in. We'll take an x-ray, one of those 3D cool x-rays, and take some pictures of your teeth, and then I'll do an exam and tell you, okay, do you need treatment or not treatment, and then if you do, we'll go through all the financial stuff. We have payment plans, insurance, so we can go through all that kind of thing with you. And one of the things we believe in is always giving back too. So I really am blessed to be able to give back to you guys, because I feel like if you can have good dental health for the rest of your life, that's something that's going to help you have a better life for the rest of your life. So glad that we can contribute to that. Okay, a couple other things. Let's see what else we have here. Oh, this is something kind of fun. If you have like a special stuffed animal or something, and if you look really closely, it's kind of hard to see it on these, but they have little braces on. And so what we'll do if you bring in, you know, I've put it on a SpongeBob, I've put it on everything you can think of, a skeleton, braces on them. And so every time you see your special animal, you'll think, wait, did I brush my teeth twice today? Or am I eating a healthy diet? You know, am I flossing like I need to? Did I go to the dentist? So again, if you want to do that, we won't charge you if you want to come in the office and bring that in. Okay, a couple other things too. Let's see. Everyone's going to get a bag to take home with them. And if I can get it untied, I'll tell you what's in there. Well, I may not be able to get it untied, but basically in there you'll get a toothbrush, and also there's a little flyer in there giving a little bit more information. Yeah, you don't have to take everything out. I think that's good. I just wanted to be. I was like, I think that's all that's in there, but got some goodies in there. Okay, so time for some trivia. Okay, so raise your hand if you know the answer, and then I'll call on you. Alrighty. Okay, the first question is, what is the worst food for your teeth? Let's see, purple. Soda, very good. Here you go. You get your very own spin brush. Yay. To keep away all the, you're welcome. All right. Okay, next question is, what is, let's see, what do the incisors do? Mm-hmm.
They kind of, they rip the...
Yeah. Yeah, they rip the food. They kind of tear the food. Very good. Okay, you're listening. Okay, another question. What age do you need to be, or should you be, oh, we got everybody. What age is a good age to come see the orthodontist? Let's see, the very back, what does it say? McKinney Lacrosse.
7.
All right, come get your, I would throw it, but I might hit somebody in the head. That would not be good. So come and get your prize. There you go. Awesome. Okay, the next question is, how many times a year should you go see the dentist? Let's see right there. 2. All right, come on and get it. Good job. Y'all are listening. We have good listeners. Okay. Let's see, got to make a good last question. Think here. Okay, I know it's Valentine's Day coming up. What is the best candy for your teeth? Okay, purple, Under Armour, chocolate. All right, come get it, girl. Yay. Okay, so, yes, dark chocolate, you got it. So I know I didn't have a spin brush for everybody, but in your bags there's a little coupon in there. So if you just bring that in the office, we'll give you a free spin brush. So it's got our phone number and everything, and like I said, there's no charge to come in for an evaluation. I think we've got time for just a couple questions. Do we have time for a couple questions? Couple questions. Okay. Yes, sir. Yes. Oh, you thought you were getting more trivia prizes. I'm sorry. Okay. Well, what did you ever just want to know about teeth or about braces or? Mm-hmm.
How do the nerves get affected by like plaque and stuff?
How the nerves get affected by the plaque? Well, I mean, if you're removing the plaque, then you probably never feel it. But if you let that plaque sit on the teeth, and then the acid just starts eating away all the layers, and then you just have no insulation anymore. So you just feel it every time anything hot or cold, or so that's how that works. Okay, another question right there. Earliest age you get braces, probably the youngest person I've put braces on is someone age 5. But again, it just sort of depends on cooperation and how and how their jaws are developing. So, let's see. Sorry, what do you have? The beads? Is that what you said? Oh, between the teeth, kind of on. Oh, and the different thing. You're very observant. So what she's talking about there's like, sometimes with our technology, we have to put these little stops on the wires, because we don't put the stops on the wires, the wire will just slide on out because it's so, it moves so fast. So sometimes we'll have to put those little beads on the wire to help that. Okay, let's see. Yes, you,
Have you only done dentistry or something else?
Really, I just kind of went straight through school. I mean, when I was in college, I did student teaching. So I did some teaching for a while with the 7th grade science. So I did work there a little bit. But just so I knew I had a lot of school, so I just went, kept going from school to school, and then just opened my business here. So, but I've loved it, and it's been great. Oh, I just thought of something I forgot to tell you guys. At your age, this probably will happen to you sometime on the playground. So you're playing out there, you knock a tooth out. What do? What you need to do, okay, is grab it by the crown, the white part that you're used to seeing. Don't grab it by the root, grab it by the crown, take it to the nurse, put it in either like some milk or some saline, or if you can't find that, just water. Just keep it moist and then get to the dentist right away. Don't clean off the root part. A lot of people think, oh, because a lot of times there'll be some like membranes and stuff on there. Don't clean that off, because actually that might help it to reattach. So people are like, oh, I scrubbed it really good. I mean, if there's dirt on it, they can sterilize it at the dentist, and dropping it in some of those other solutions can kind of clean that off. But you don't want to really get in there and scrub on it, because that'll prevent it from being able to be reattached. Now, if it's just a piece that trips off, don't worry about trying to find that piece, because then they wouldn't glue that piece back on. They just would do like a bonding or something like that. Okay, but I just thought at your age, y'all are at that prime age of knocking teeth out and having accidents. So.
Why do your teeth split in half sometimes when you lose them?
Oh, that's a good question. Why do your teeth split in half when you're losing them sometimes? Well, if you remember from that one x-ray, the 3D x-ray, what happens, like if the permanent teeth are coming down and maybe it's coming through the middle of the baby tooth, and then, so sometimes it'll just break the baby tooth in half. So that's nothing to worry about. It's just, sometimes it's just the way that tooth comes in.
I pulled out my tooth sometimes and the next day it was split in half and I didn't know why.
Yeah, so that happens sometimes. Or, you think you get a piece out and then another piece kind of works its way out too. So. How much are braces? Well, it depends on how complex your case is. The more severe bites are going to be a little bit more expensive. But we have payment plans and everything. The best thing is just to come in. Like I said, it's a free consultation, and so it's just kind of arranged depending on what we need and what we need to do.
Does braces hurt?
Like I said, just touch your teeth is what it feels like, and it's almost like if you've been in PE and you're running a lot and your muscles get a little sore, so it might just feel a little soreness. Sometimes you might take some ibuprofen, but it's nothing like it used to be when I was growing up. It's amazing, because I had braces as a teenager, and then about 5 years ago I put on some of the Damon Smile braces because I just thought, oh, I can tweak it a little bit, and it was just amazing, the technology. I just didn't even feel it this time like I did when I was growing up. So it's a lot easier than it used to be, especially with our technology.
What if whenever your tooth is coming out, what if you swallow it?
Ooh, well, luckily the teeth are pretty small, and usually it'll pass on through, so it's usually not anything major to worry about. But things do happen. But just kind of watch if you're coughing. You don't want it to get aspirated into your lungs. But most of the time, I think usually it just passes on through. Let's see, someone who hasn't got to ask one. Yes, the stripes, yeah. Oh no, if you pull out 1 and 4 come out, well then they probably were all ready to come out. Sometimes that happens. Like you won't lose teeth for a while, and then all of a sudden, y'all are kind of at that age where all of a sudden you're going to start losing a lot of teeth. You'll just be bringing a new one every day to your family, like, oh, that's another one. Okay. Does everyone get braces? Well, I would say probably about 85% of people need braces to correct, some kind of jaw problem. And really, genetics play a part. So if your parents had braces, you probably are going to need braces. But then also, we're finding the environment, a lot of allergies. A lot of people, if they can't breathe, they're kind of breathing like this, so their jaws don't develop correctly. Or again, if they're having tonsil and adenoid issues, and we're just seeing a lot more crowding. Our diets have changed so much that we're not really using our muscles to chew our food. So when you're not using your muscles, your muscles kind of get weak, and they don't help everything develop like it used to. I did a research project when I was in school, and I had all these skulls of some American Indians, and what was amazing, all their teeth were perfectly straight, but they wore down off the cusps of their teeth, because what they were eating had like just big rock grit, and grind up in their diet, so they're kind of chewing on rocks. So they used the muscles, so they had their jaws were large, and they could even have their wisdom teeth. But again, they sheared off all the rest of their teeth because of their diet. So again, kind of being somewhere in between would probably be better. Okay, you right there, yes. What if you? Oh, it's usually not a problem because most of the time we don't put braces on baby teeth, so that way they can be just lost underneath. Every now and again, if I have to put a brace on a baby tooth, I always tell them, okay, don't worry if this gets loose, just call us, but we don't do that very often. Okay, way in the back over there, yes. Yes? Are there different kinds of braces? Yes, there are. There's all different kinds of technology. So there's kind of the traditional braces, and like I said, what we use are the Damon Smile braces, and I love that because we don't have to use a lot of the other gadgets, a lot of the headgears and the expanders and all that, because this one moves the bone and the teeth. So, okay, I think it's time for one more question. How about in the purple right there? Can you put braces on cats? I guess you probably could. I mean, not me, but maybe the veterinarian can. I guess, same as the dog. The dog needed them, so I guess if a cat needed them, they do it. All right, guys. Well, I really appreciate all of y'all's questions and help. And you can go to our website. I mean, if you want to email me a question, McKinneybraces.com will answer your questions. I've got all the information. But thank you for your attention. You did a great job.